Okay, fine. Thank you.
Yes. So, very, shall I say good afternoon or good evening? Good evening to you all. And this is the first awareness program after the lockdown. That is, we are having in our college, and this webinar, state level webinar on cancer awareness, is being organized by the Science Promotion Committee of the Lady Broden College with the patronage of our beloved principal, Professor Chuli Sarkar. And on behalf of my two other colleague conveners, that is Dr. If I can I request Dr. Day to just mute her mic for the time being? Yes. So am I audible now?
Yes, perfectly audible.
Okay. So on behalf of my two other colleagues, Dr. Apia Ganguly, head of the department, chemistry department, and Dr. Kea Bose, head department of physics, I welcome you all to this cancer awareness program of our college. And it is my pleasure to welcome our esteemed speaker, Dr. Arundhati De from Apollo Gleneagles Hospital. And I think, and also the audience. And today, I regret that today we are having some problem because we didn't know that Google has restricted the audience limit up to 100. We thought it was 250. So that is why we have some delay. I'm sorry for the delay, and now we can start. And I would like to request Dr. Surojit Bhattacharya, who is from Apollo Gleneagles Oncology Division, to introduce our esteemed speaker, Dr. Arundhati De.
Madam, thank you. I am not a doctor. I am Mr. Surojit Bhattacharya. I am the service line manager. Never mind. I would just like to introduce Dr. Arundhati De. She is the consultant here at Apollo Gleneagles Hospitals, taking care of the radiation oncology part. And she would like to speak on the woman cancer. On the woman cancer and the awareness part, she would like to bring out certain queries among the audiences, and all the audiences are expected to raise their hands on with the queries, with the pertinent queries where they would like to ask anything to Dr. Arundhati De regarding the awareness of cancer. Over to Dr. Arundhati De.
Good afternoon, everybody. It's my pleasure to address such a learned audience, I think. So, Madam, first I want to share my screen. Is the option available? I don't think so.
Yes. Richa, you please help her.
Yeah, I want to share my screen, but that option is not popping out here. Just a minute. No, I don't think so. Right side bottom, no, not yet. No, I am with my MacBook actually. Just a minute, it's being. Just a minute. Just give me 2 minutes. It's not. Is the presentation visible? No, I am visible, but the presentation is not visible, I think.
You can just go to the presentation page.
Mm-hmm.
Click on that.
Yes, it is now visible. It is now
It's
visible.
visible, no? Okay, okay.
Yes, yes.
Thank you. Thank you. Yeah, I think it's perfect. Yeah, thank you. So today it's a women cancer awareness program, I think, and I just want to emphasize that first I will cover some general issues, that is what are the causes, signs, symptoms, or the preventive measures, and after that I will cover the main thing, that is women cancer awareness. Okay, and I want this discussion to be a two-way discussion where you people should interact with me. That would be beneficial for you people also, and for me also. It will be I think that it will be more fruitful. Okay, so I'm starting my presentation. First, what is cancer? I think whoever is studying in the Leti Brabon, he or she, sorry, it's not he, she is quite aware that the fact that cancer is a group of disease involving abnormal cell growth, where the potential to invade or spread to other parts of the body is there. So in the layman's language, when a cell starts dividing in uncontrolled manner, it is causing a cancerous disease. So coming to what is cancer, it is again the same thing. That is, most important characteristic of a cancerous cell is its aggressive nature. It can spread directly, it can spread through blood vessels or through lymphatics. These are all theoretical things. Okay, so what are the causes of cancer? Most of the cancers, they don't have any specific cause known till date, but it's also true that there is some specific risk factor for some specific cancers that can make an individual more prone for that specific cancer. So we all know that smoking and use of tobacco in any form, that is, be it gutka, be it in pan, betel nut, all these things, their use makes an individual more prone for cancer development. Again, drinking alcohol. We all know that smoking and alcohol, they have a synergistic effect on causes of cancer. So some chemical substances like some asbestos, etc., some specific dye or paint, some environmental pollution. These days, two main things that are causing cancers are environmental pollution and the dietary habit. Now, eating habit and personal hygiene. Nowadays, generally we are taking more and more fast food from outside, and we are becoming obese. So it's a predicting factor for cancer also. So, and one more important thing is lifestyle and sexual practice. Like our lifestyles, most of us who are leading a sedentary life, they are more prone for obesity and indirectly to cancer. There are some other issues, that is microbial infection. I will go into details in the later slides. Now, what are the common signs and symptoms of cancer? Hello? Am I audible? Okay, thank you. So these are the common signs and symptoms of cancer. Like sometimes someone starts to have cough. Anybody can have cough or fever or cough and cold, but if a dry cough, specifically a dry cough, if it stays for more than 1 month, along with some other symptoms like weight loss or fever, then it should be addressed. Any type of growth, be it in the inside your oral cavity. Sometimes patients come to us with complaint of a non-healing ulcerous lesion in the tongue. Patient, he or she says that it has been there for quite a long time, for 6 months, for 1 year, and they have previously they have thought that it is being caused due to the erosion by the sharp tooth. If one is having this symptom like a non-healing ulcer caused by a sharp tooth end, then he or she should go to the dentist for at least once to check that whether it is really a sharp tooth that is causing the cancer or it is otherwise. Sometimes patients complain of some bleeding from mouth, bleeding from nose, bleeding from rectum or vagina. Any type of abnormal breathing, be it from bleeding, be it from nose, from oral cavity, from vagina, or from it may be rectal bleeding, it should be taken as an abnormal thing and it should be addressed. Some type of swelling, like sometimes in the due to the common cold, we face some swelling in our neck area. So we normally we call it as gland swelling or gland enlargement of gland, but maybe it's a normal common thing. But if it is persisting for a long time, then it should be addressed. Next, coming to any swelling or lumpy feeling of the breast, it should be addressed as early as possible. I will go into details in later slides. So, and one more thing is there, along with cough, there is one important thing, that is hoarseness of voice. Sometimes patients complain is there that there is a voice change for a long time. It may start with a common cough and cold, but it may persist for 6 months, for 7 months, or 1 year. Patient is having a problem of voice change or hoarseness of voice. Then it should be addressed. So these things I have already discussed. One more thing regarding this abdominal malignancies, most of the cases patients complain of difficulty in bowel or bladder, or change in bowel or bladder habit. Some patients, generally some patients have previous complaint of constipation. That is their normal thing. But if that patient starts to pass stools twice or thrice or 4 to 6 times a day, that's also frequently, even if the consistency of the stool is not changed, if the patient was previously constipated and nowadays he or she has started this having this type of bowel movement, it should be addressed if it is long standing. Or sometimes patient whose normal history is to pass stool normally, but for some days he or she is experiencing something that is like constipation along with blood tinged passage of stool, then it should also be addressed. And regarding the female cancers, one most important thing is white discharge per vagina, postcoital bleeding, intermenstrual bleeding, and postmenopausal bleeding. These all things are important because in our country, we most of the female patients come to us at a later stage of the disease, whereas the common signs and symptoms were there for 6 months, 1 year. But in our society, female intimate hygiene is not always addressed in a good way. So these things, these specific signs and symptoms like white discharge, especially foul smelling white discharge, postcoital bleeding, that means bleeding from private parts after intercourse, intermenstrual bleeding, that means someone is having her normal menstrual cycles, but in between she is experiencing some spotting. It may be minute, but it is regularly there, then it should be addressed. And one more important thing is postmenopausal bleeding. Actually, the thing is that I think today my audience is a younger population, consisting of younger population. But the most important thing regarding an awareness program is that through this program, I want to aware not only you people, but also I want that some input if you people take from my slides, and you can share it with family members, female family members, that will be helpful. Sorry. And also there is one more sign and symptom maybe there, that is sudden changes in moles or nevus that were there for a long time. This recurrent fever, anemia in children, it is generally not associated with adult cancer symptoms. It is generally associated with children leukemia or lymphoma, etc. And we all know that sudden weight loss or weakness, one may lose weight with diet plan, but severe weight loss more than 10% in last 6 months, it's an important parameter. And sudden onset of weakness without any specific cause, it may be a sign or symptom of cancer. So I am not going into details of these things because I want to emphasize on women cancer mainly. So how we detect cancer, there are many methods, but most important or most confirmative method is histopathology, for which FNAC or biopsy from the cancerous cell is needed for most of the cancers. And regarding the treatment of cancer, there are many treatment modalities. It may be surgery, radiation therapy, chemotherapy, biologicals, hormone therapy, and for most of the cancers, multimodality treatment is needed. So how to prevent cancer? There is no specific guideline, but these things we can, if we use in our lifestyle, it can be preventive. Like stop smoking, alcohol, tobacco. You have to screen some for specific cancers. There is specific screening program. If some people go through the screening programs, with that early detection and early treatment can help. There can be lifestyle modification, and for some specific cancers there is role of vaccination also. So coming to my main topic, that is firstly I will deal with breast cancer, and then I will deal with gynecological cancer. So a few words on breast cancer. It's one of the most common cancer among Indian women. It can be familial, but it's not always familial. Most of the patients, they are having sporadic cancer, like that means some people have history of breast cancer in their maternal side, like their mother, their elder sister, their younger sister, or any of the female family members. But most of the females having breast cancer don't have any family history. Okay. And one more important thing is that breast cancer can be screened. Breast cancer can be detected earliest in the screening program, can be treated with a curative intent. But most of the patients in our society, they come for doctor's consultation at a later stage, where the treatment protocol is more complex, and sometimes the disease cannot be treated in a curable intent. Okay. So who are having more risk for female breast cancer? Obviously, if you are a female, you are having more risk. The risk factor increases with age. Family history, I have already said that if there is family history in the maternal side, most of the people know that if there is a breast cancer history in the maternal side, then it's a risk factor for an individual. But nowadays, studies have proven that in the paternal side also, if the female relatives of the paternal side, like your paternal grandmother or paternal aunt, if she was having a history of breast cancer, individual female is more prone to have breast cancer. There is some specific genetic factor. The most important thing for breast cancer development is hormonal exposure. A female who is having early menarche and late menopause, that means whose menstrual period is being lengthened. That is, early menarche means before 12 years, and late menopause even after 55 years of age if she is having normal menstrual period. Then that specific female is more prone to develop breast cancer. Also, nulliparity or first conception after 30 years. Nulliparity means one female who has never born a child. She is at high risk. And also nowadays, with our change in the lifestyle, our age of first conception has also increased. Most of the females, we are busy with our career, busy with our own things. So the age of first conception is going beyond 30 years. If age of first conception is going beyond 30 years, then it's a definite risk factor for breast cancer. And some patient, if she is having history of radiation to thoracic region at an earlier age, specifically for lymphoma or any other disease, then she is at high risk. So this is one most important slide, that is, what are the symptoms of breast cancer? There can be small lump, there can be visible lump, there can be dimpled or depressed skin. A small dimpling in the skin, a visible swelling, there may be a small lump that is not at all visible. There may be discharge from the nipple. There may be inversion or change of shape in the nipple. There may be bloody discharge, there may be texture change. Sometimes there is the skin change over the nipple and areolar area is the only visible sign of the breast cancer. And sometimes there is a color change also. And most of the cases, this cancerous lump is painless. That is the most important thing, that as it is painless, when it is not visible, it is not addressed also. Sometimes a female feels a lumpy thing in her breast, but it is painless, it's not causing any problem, so she ignores it. That is not a good practice actually. So, and along with the breast lump, there may be lump in the armpit or lower neck. These areas are also very important. I will show in my later slides that while doing breast self-examination, one should examine armpit or lower neck also. So, what are the treatment modalities for breast cancer? These are the treatment modalities. I have already said that surgery, chemotherapy, radiation, hormone therapy, and biologicals. And most of the cases, more than one modality are required for the treatment. So, is there any tools for early detection? Yes. Most important is self-breast examination. That is the most important thing. And one more tool is also there, that is mammography. So, what is the self-breast examination? This is the thing. Okay. So, these are the steps. First, the individual female has to stand in front of a mirror where she can see her full image, at least up to the waist. You have to place your both hands on the waist, and you have to just observe the breast contour. If there is any dimpling or skin changes or any abnormality is there, then you have to address it. Second position is you have to raise your both hands like this and make this fist. Again, you have to just observe this thing if there is any contour change or skin change. Third position is you have to lie down on a pillow in a comfortable position. You have to palpate your breast yourself. You can start in the middle here in the central part, then you can go around on the whole breast region. You have to press the nipple. You have to press the nipple for any discharge. It may be bloody discharge, it may be watery discharge, it may be milky discharge. any type of discharge if the female is not breastfeeding, the female is not breastfeeding, but she is having any type of discharge, it should be addressed. And this is another position. The female have to self-examine in the lying down position and in the standing position in the same manner. So, which part of the palm you should use? You should use this thing, the upper part of the palmar surface of the first 3 fingers. You can examine this way, like starting in the middle, you can go the whole breast. You can use this way, like zigzag manner, but you have to cover the whole breast. So, who are the candidates for the breast cancer screening? All women aged more than 20 years is a candidate for breast cancer screening, both for mammography and self breast examination, and this examination should continue throughout the life. So, when do you do this breast self examination? Can you do any day in the month? No. You can do it any day in the month, but better to fix a specific day. Which day? 2 to 3 days after your period ends. This had a specific cause, because sometimes breasts are tender, or there is some vague lumpiness just before the menstruation or during menstruation, but that gets resolved immediately after the menstruation period is over. So you have to choose, it's better to choose the day 2 to 3 days after the period ends. How often will you examine? Once a month. Once a month examination, self breast examination is enough. So after menopause, if the female is post-menopausal, then what she will do? After menopause, pick a certain day, such as the first day of each month. You can choose a specific date, like first day of each month, you will examine your breast, or you can choose a specific date like 6th of every month or 10th of every month. If someone is taking hormones like OCP, oral contraceptive pills, or someone is taking hormone replacement therapy, that's for postmenopausal. For premenopausal, if some woman is taking OCP or hormone, then you have to do the examination after 1 to 2 days after the withdrawal bleeding. Like the tablet is stopped, after that withdrawal bleeding started, it has stopped. After that 1 to 2 days, you have to do the self breast examination. So, coming to the mammogram, what is the mammogram? It is nothing but a specific type of X-ray of breast, but it's capable of detecting small tumors that cannot be felt during a physical examination, be it may be by the female herself or by the clinician. That type of small tumors can be detected by screening mammogram. So women with an average risk of breast cancer, they should start screening between the age to 45 to 54. Average risk means they have no specific risk factor, like they have no family history, they have no previous personal history of radiation to the thoracic region, etc. If the woman has a greater chance of developing breast cancer, like these risk factors, she may choose to start between 40 to 49. And there is no upper age limit where you can stop the screening. You can continue it lifelong. It's for the mammography. But for the self breast examination, I am repeatedly saying that it should start after 20 years of age. So, this is the guideline for breast cancer screening. If it is breast self-examination, it should be done at more than equal to 20 years. If clinical breast examination, that means breast examination by a clinician. So it should start at the age of more than 40 years. And for if it is started before that, due to any cause, like the specific female has a risk factor, and for that she is undergoing a clinical breast examination by one physician. If the female is less than 40 years of age, it should be done 3 yearly. If in the she is the age of more than 40 years, it should be done yearly. For mammography, for more than equal to 40 years, it should be done annually. So, so here I am concluding the breast cancer part. If there is any question, I will address later on. Okay. So coming to the cancers of female reproductive system, what are the most common gynecological cancers? It is cancer cervix, endometrial cancer, ovarian cancer, vaginal cancer, vulval cancer. Among them, cervical cancer is the most common and one of the most important cancers in Indian women. So, what are the causes of cervical cancer? Unlike breast cancer, there are some specific predictive causes for the cervical cancer. What are they? Sexual exposure from a very early age, uncontrolled and unprotected sex, multiple sexual partners, both for the female and the male partner of the female. If a male partner of a specific female, the male partner is having multiple sex partners, then the specific female is more prone to develop cervical cancer. And most importantly, lack of personal hygiene. It's very important for our Indian society, where female private parts are not being addressed adequately. So these factors, what does they do? They make the individual more prone for HPV infection. What is HPV? It is human papilloma virus. And most of the cervical cancers caused by this HPV. And these specific risk factors makes one individual more prone for HPV infection. So, what does HPV infection cause? HPV infection causes long-term inflammation in the cervix region, and that predisposes for the cancer. That's why female from poor socioeconomic background, where there is their hygienic practice is not there, there is lack of personal hygiene, they are more prone for the cervical cancer. But one important thing is that nowadays, frankly speaking, in the previously, this cervical cancer was a disease for the low profile, low economic group of people. But nowadays, we are seeing people from the middle class family or upper middle class family, where they are suffering from this disease, that is cervical cancer. So what are the symptoms? Unlike breast, cervical cancer gives symptom at a very earlier stage. And if the symptoms are addressed properly, it is totally curable disease. That's the most important thing. So what are the symptoms? Long-term foul-smelling white discharge, white vaginal discharge specifically, it will be foul-smelling. Post-coital bleeding, that is after intercourse there may be bleeding. Any bleeding other than menstrual bleeding. Post-menopausal bleeding. Any injury or non-healing ulcer in the private parts. Sometimes none of these symptoms are there, only vague lower abdominal or low back pain is there. If a vague lower abdominal or low back pain is none of there, these symptoms are there, only vague lower abdominal or low back pain is there. So if any of the above symptoms is there, consult with the doctor as early as none of these symptoms are there, only vague lower abdominal or low back pain is there. So if any of the above symptoms is there, consult with the doctor as early as none of these symptoms are there, only vague lower abdominal. Some basic investigation is there, like so if any of the smear or pap smear, colposcopy, punch biopsy from cervix can detect cervical cancer early. Am I being clear? Hello?
Yes.
I am audible, but are you people getting benefited? I mean, I am understandable. Am I understandable?
Yes, you please carry on.
Okay, thank you. So what are the treatment modalities for cervical cancer? Again, there is surgery, radiation therapy, external beam radiation therapy, and internal radiation therapy, chemotherapy. For again, like breast, For early stage cancer, single modality treatment will suffice, but for advanced stage, again the multimodality will be required. So, is cervical cancer preventable? Yes. Some of the cancers are there that is preventable, and cervical cancer is one of them. Female has to maintain her personal hygiene, has to avoid unprotected sex, avoid multiple sexual partners, and avoid early sexual exposure. After a certain age, regular pap smear test should be done, and there is a role of vaccine also. HPV vaccine is available for cervical cancer. That is not a foolproof protection for cervical cancer. I am again emphasizing on this that it is not a foolproof protection, but it gives good protection against cervical cancer. So, pap smear, when to start, how frequently you have to undergo this test, how long you have to continue. And coming to HPV vaccine, whom to give, when to give, how many to give. So, regarding this pap smear, you should start once a female becomes sexually active. After that, pap smear investigation should be started, specifically after the age of 30. If one female is sexually active, she should undergo pap smear at the regular interval. How frequent? At least yearly. How long? As long as she is sexually active, and sometimes after the 70 years of age, you can stop doing this pap smear. Now coming to HPV vaccine. Whom to give? HPV vaccine is efficacy is mostly for the females who are not sexually active yet. That means for specific vaccine, there is specific age group who can use that vaccine, but for all of them, the efficacy will be maximum if it is given before the sexual exposure. So when to give? There are many brand of the vaccines, but there are two specific vaccines that are mostly used by the gynecologists. That is, one is Cervarix and one is Gardasil. What does that do? They are giving specific protection against some specific strains of vaccine, specific strains of HPV virus. They are not giving protection against all strains of virus, but they are giving protection against the virus for most of the strains that causes most cases of the cervical cancer. Regarding this HPV vaccine, most of the vaccines, they are started that can be given at the age of 9 to 12 years. If a girl child is aged 9 years, she can be given the HPV vaccine. The schedule is 0, 6, 12. You have to give a single dose, then you have to repeat after 6 months and again after 12 months. That's the vaccination schedule. So here I'm concluding the cervical cancer, coming to few words on endometrial cancer. Endometrial cancer, most of the cases, it is a disease of the elderly female population. Generally, female less than 50 years of age are not affected. So more than 50 years are mostly affected. Most common symptom is postmenopausal bleeding. But along with the change of our lifestyle, that is obesity, along with the comorbidities like diabetes, hypertension, with these, incidence of endometrial cancer is also increasing day by day. It is curable if it is detected early, and surgery and radiotherapy are the main modalities for the treatment here. Regarding ovarian cancer, women of any age group can be affected. There is familial propensity. If a female has history of breast or ovarian cancer in the family, she is more prone for the ovarian cancer. So what are the symptoms? Ovarian cancer generally present with vague symptoms like pain abdomen, fullness of abdomen, early satiety, weakness, anemia, and sometimes only huge pedal swelling. That means swelling of the lower limbs. They can be the common symptoms of the ovarian cancer. So what are the diagnostic tools? You can use ultrasound, CT, serum marker. Again, surgery and chemotherapy are main modalities, but ovarian cancer, if it is detected early, it is curable, otherwise not. Most of the ovarian cancers are detected in the later stage, and where it is not curable, at least. In fact, it can be controlled, it can be taken care of, but it cannot be cured there. So, one thing I would like to emphasize that regarding any type of cancer, be it specifically women cancer or any type of cancer, awareness is the key. If we are aware of the fact that cancer is there, someone can be affected with cancer, then this awareness can prevent and detect cancer in early stage. And if it is detected in early stage, most of the cancer nowadays we are equipped with improved treatment, developed treatment protocols, where if we can detect early stage cancer, it can be cured. So be aware, spread awareness, be aware yourself and spread awareness among others. So a big thank you to you all. And if there is a question, I'm happy to take that.
Okay, if anybody wants to ask questions, they can give their questions, write their questions in the chat box, or directly ask Dr. Day.
There are 2 questions in the YouTube chat box.
কি করে আমি বুঝতে পারবো? দেখতেই পাচ্ছি।
Questions in the YouTube. Somebody has to read the questions.
Okay, I think there is a question from Ishani Chatterjee.
Yeah.
Dr. Day, yeah. Is the vaccination on cervical cancer also will be useful for a woman who is having malignancy on breast or any other parts of the reproductive system?
Yeah, if the vaccination for cervical cancer, if it is given prior to the sexual exposure of the specific female, then it will be a maximal efficacy will be there. It is not related to the breast cancer or any other cancer of the cancer of the female reproductive system. Like if the female is suffering from, I think she wants to know if the female is suffering from the endometrial cancer or vaginal cancer, like that, right? But the thing is that it is, if the female is suffering from endometrial cancer or vaginal cancer or vulval cancer, that means in most of the cases she is not aged between 9 to 12, or in a straight word, she is already been exposed to the sexual act. So there someone can take vaccination, but it will not be that much beneficial actually. That's the thing. It is not related to the malignancy, that if the female is having any malignancy, for that the vaccination cannot be given. It's not like that, but it will not be beneficial if it is given after the sexual exposure of the specific female. I think another question is there. What are the chances of benign breast tumor to turn malignant? Yeah, the thing is that benign breast tumor, there are specific 2 entities. One is fibroadenoma and one is fibroadenosis. Fibroadenoma is these 2 are, I will say, it's very common actually among females. Fibroadenoma is a specific tumor or lump. It may be more than one in the breast. And fibroadenosis is a vague lumpy filling in the breast. In both the cases, this lumpy filling or the specific lump increases in size or may increase in size, along with some tenderness during the menstrual period or just before the menstruation. It is not guaranteed that this type of benign breast disease will not turn into cancer, but they have a very low malignant potential. That means they can turn into cancer, but it's not mandatory that if someone is suffering from fibroadenoma or fibroadenosis, she is at a greater risk of developing cancer. That's the thing. Okay. So next question is, ma'am, can HPV vaccine be given to women of age 20 years or more? How frequently should it be taken? Yeah, it can be given. I am emphasizing again and again that a specific woman, for that woman, the vaccine will act maximally if it is given before the sexual exposure of the specific female. After sexual exposure, if the vaccine is given, it can act, but the efficacy will be less. And how frequently means the dosage schedule is 0, 6, 12. That means single dose. You have to repeat it after 6 months and again repeat it after 12 months. Better to go to a gynecologist, and generally they take care of this schedule. Okay.
Okay,
Next
there is,
question.
may I interrupt? There is, you have missed one. That is from Barnali Ray Basu. Can recurrent vaginal infection lead to cancer?
The thing is that yes, the simple answer is yes, because recurrent vaginal infection means two things: lack of personal hygiene, number one, and number two, recurrent vaginal infection means recurrent or long-standing inflammation of that part. Both these, I have already said that lack of personal hygiene and long-standing inflammation or infection, they both are risk factor for the cervical or vaginal cancer. So if there is recurrent vaginal infection, then yes, surely it is a risk factor for that specific individual.
I think there is, next one is, my mother suffered from head and neck cancer, and she had to undergo surgery, chemotherapy and radiation therapy. Am I more prone to any sort of cancer because of this? This is from Srinjana Das.
No. The thing is that for head and neck cancer, there is no such thing like heredity. For breast, for ovary, specific proof that if one family member is suffered from that, then the individual is more prone to it. But for head and neck cancer, it is not so. If someone's mother is suffering from head and neck cancer, undergone anti-modality treatment, that doesn't mean that the individual or the son is more prone to that type of cancer. Okay.
Okay, the next one is from Victoria Roy. If we observe any inequality between two breasts, is there any possibility of breast cancer?
No, if it is the normal anatomy of the individual, it's very common that the size of both the breasts are not equal. If it is the normal anatomy of the individual, there is no issue. While one individual is absolutely sure about the size shape of his own breast. So while doing breast examination, if the individual doesn't notice any sort of change or abnormality from her normal anatomy, then it's absolutely perfect. It's a very common thing to have different size for the breast, actually. Any other questions?
Okay, I think there are a couple from the YouTube. I am reading it, okay? This is from Aisha. Both the questions are from Aisha Mahmood. She wants to ask, are people on hormone therapy more or less susceptible to breast cancer?
Yeah, that's a good question actually. Hormone therapy, it can be of two types. It can be oral contraceptive for the premenopausal women of the reproductive group. It can be hormone replacement therapy for postmenopausal group of women. Regarding the OCT or the oral contraceptive pill,
I think Dr. Day has been disconnected. Let us wait a little bit. Richa, yes, can you do something? Okay, 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 okay. Yes, yes, okay. Let's just wait a little bit.
Yeah. I got
Okay, okay,
disconnected actually.
okay. So you were actually saying about are people on hormone therapy more or less susceptible to breast cancer or not?
No. The thing is that if the specific female is having previously, she is having specific risk factors like family history or history of radiation in the childhood to the thoracic region, then she is having, she is, hello? Yeah, okay. Then only she is having more risk for breast cancer if she is getting hormone replacement therapy. Otherwise, if she is not having any previously present risk factor, then it is not a risk factor for the breast cancer if the postmenopausal female is getting hormone replacement therapy. That's the thing.
Okay, I think there is one question from Monisha Mukhopadhyay. Am I audible?
Yeah, you are audible, ma'am.
Okay. After menopause, the cysts in uterus may cause cancer.
The thing is that uterine cyst, if it is long standing, that means it is there for the some time, then it should not cause any problem. But after menopause, sometimes this uterine cyst, due to the hormonal changes, there is some tissue changes, and there is a chance that they turn into malignant. So postmenopausal bleeding, if it is there, even if there is postmenopausal spotting, it may be due to the malignant changes inside. So it should be addressed as early as possible. It is not that if there is uterine turn into cancer, it's not like that. But there is a small propensity that after menopause, if there is postmenopausal bleeding, it may be a sign of cancer. That's the thing.
Okay, there is another question from Anushmita Ganguly.
Yeah.
Are women suffering from PCOS more susceptible to female reproductive cancer? Is there any preventive measure that can be undertaken?
Regarding the PCO, it's a lifestyle disease. Most of the cases, and it's rising day by day mainly due to our change in lifestyle or our diet practice. So most of the cases itself, PCOS or polycystic ovary, the thing, it's not a direct cause of female reproductive system cancer. Sometimes the hormones used to treat these things, though these most of the pills are using small quantity of hormone, but long-standing use of this hormonal treatment may cause some hormonal imbalance and may cause cancer. That's why females having PCOS or polycystic ovary disease, most of the cases, they are advised to take first pregnancy as early as possible, because for PCOS, it's the definitive treatment. If it sometimes it does not cure the polycystic ovary, but it gives a better outcome. That's why most of the young females, they are advised to conceive as early as possible, so that the PCOS hormonal imbalance can get a bit decreased, so that you don't have to use that hormone containing pills. You don't have to use that type of treatment for a long time. That's the thing. Okay.
Next question is from Shunobha Shaha. Is endometrial cancer completely curable? If a woman undergoes irregular and excessive bleeding at the age close to menopause, can that be a sign of risk?
There are two questions actually. First, endometrial cancer, I have already said that if it is detected early, it is curable. If it is detected early, it can be cured with surgery followed by radiotherapy. With increasing stage, it doesn't remain that much curable. Then the intent of treatment is sometimes to control the tumor. Most of the cases, you need systemic chemotherapy along with the definitive surgery and radiation. So if it is detected early, it is absolutely curable. And coming to the second question, yes, if a woman is near menopause and having severe menstrual bleed, it may be a sign of endometrial cancer or uterine cancer. Sometimes I have already said that if there is pre-existing cyst in the uterus, during the perimenopausal, just before menopause or just after menopause, that perimenopausal time period, there is some changes in the uterine cyst, and they may cause uterine bleeding. So for that, sometimes doctors advise for hysterectomy, that is removal of the uterus. That's the main thing, because there is a chance for the endometrial cancer, and if the uterus is removed and the specimen is biopsied or histopathology can be taken properly, then it is it's better for the patient to get the proper treatment actually. So in one word, yes, premenopausal excessive bleeding can be a sign of the endometrial cancer.
Okay, next question is from Debushmita Guho. Does discharge from nipple always correspond to breast cancer, or
No, no,
it
no.
can occur due to hormonal changes after a certain age?
Yeah, it's not always a sign of breast cancer, but definitely it's not a very normal thing. Like if one female is breastfeeding her child, after stoppage, sometimes after stopping breastfeeding also, there may be some nipple discharge, milky or mainly milky discharge. But at the same time, if it is bloody discharge, or if it is serous or watery discharge, that is not a very normal thing. And one more thing is that sometimes female using OCP, oral contraceptive pill, they can experience, it's not a very common thing, but some female can experience milky discharge from the nipple. So it may be a sign of breast cancer, but not always.
Okay, next one is from Saima Naz. She's asking, is there any relation between breastfeeding and breast cancer?
Actually, it's a very important topic that breastfeeding is actually preventive for breast cancer. If a female, I have already said a female, nulliparous female is at more risk for breast cancer. Female conceiving after 30 years for the first time is at risk for the breast cancer. At the same time, if the female is not breastfeeding her child, she is at the risk of breast cancer. So breast cancer is preventive, breastfeeding to the child is preventive for the breast cancer actually.
We have another question from Srijita Roy. My paternal aunt suffered from breast cancer in 2000 and had undergone surgery, chemotherapy, radiotherapy, and then again after 17 years, she again got affected by cancer, which led to her death in 2017. Her son also suffered from benign tumor in 2018. So, is there any chance of cancer again affecting him? Is there any hereditary connection?
So first I have to know what type of benign tumor was the son suffering from. That's the thing. Because generally from, if the mother is suffering from breast cancer and have died from that also, but the son is not generally is more prone for any type of cancer from that. So I think she has already prostate benign tumor. Is it so?
I don't know, Srijita, can you answer that?
Yes, she has said that, yeah, prostate benign tumor, I think there is not any entity like prostate benign tumor. There is one entity named benign prostatic hypertrophy. Okay, if it is benign prostatic hypertrophy, then BHP is not a very proven risk factor for cancer prostate actually. If it is benign prostatic hypertrophy, then it is not a very very important risk factor for carcinoma prostate. But I don't know any entity about benign tumors of prostate actually. There is no such thing. But most of the cases, if the mother has suffered from breast cancer, the son has not that much propensity to suffer from any sort of cancer. He can suffer, but it is not due to hereditary causes. Okay.
This is from Shreyoshi Maulik.
Yeah.
Is it risky to use contraceptive methods like IUD, etc.?
IUD is not proven as a risk factor actually. Sometimes IUD is not a very common practice because IUD may cause some inflammation inside, and it is a bit difficult if the IUD inserted in inside a female, if causes an inflammation, it becomes sometimes difficult to remove that thing. That's the problem. But IUD specifically itself, IUD is not a risk factor for cancer.
The next one is again from Deboshmita Guho. Can Botox treatment or gene therapy cause cancer, as we are trying to change some natural phenomena using those methods?
Actually, Botox therapy and gene therapy are two entirely different thing, I think. So Botox therapy, there is no proven thing that Botox therapy, if used recurrent way, it cause cancer. But the who has asked the question, she has already herself said that we are changing the natural thing. So whenever a foreign body or a foreign thing is inserted or being used on our body, it may cause some irritation or inflammation that may cause cancer in the future. And regarding the gene therapy, no, there is no such evidence that gene therapy may cause cancer, at least still now.
Okay. There is one question from Shomdatta Chatterjee. In some cases, after menopause or just before the menopause, some women are going through uterus operation or hysterectomy. What is the exact cause of this? You have, I think you have discussed this.
Yeah,
huh?
I have discussed this actually.
Yeah. So there is one from YouTube live streaming. Can from Aisha Mahmood, can radiation therapy cause skin cancer?
No, radiation therapy, there is no proven thing that radiation therapy can cause skin cancer. If regarding breast cancer, I have already said that if the specific female has previous history of radiation to the thoracic region, that is chest wall or thorax in the previous years, that is in the childhood, for lymphoma or any other thing, it may give a propensity for breast cancer for that individual. But radiation per se is not a causative factor for skin cancer. Skin cancer, most of the cases, skin cancer is caused by ultraviolet rays. And for that, we are lucky enough that in our country, we are not getting that thing, because in the Western world, most of the people, they are very fond of that sunbath or tanning.
Yes.
For which they are most prone for this skin cancer thing. We are lucky enough regarding this thing. Okay.
I think this is the last question. It is again from Aisha Mahmood. How exactly does pap smear test work?
Okay. Pap smear test. In the pap smear test, the smear or the specimen is taken through here we use a spoon-like thing. The gynecologist taking the specimen use a small spoon-like thing, and this spoon or small thing takes a small bit of tissue. The thing is, actually it takes a small bit of mucosal tissue for the examination, and it examines the cell type actually. So through pap smear we can assess what is the cell type present in the that region. And for the pap smear, we usually take this thing like the cervico-vaginal junction. That is the region from where the pap smear is taken. Or we can say that it is the squamo-columnar junction. Two types of cells, their junction is being addressed for the cell type. If the normal cell type is present there, then it's okay. Otherwise, sometimes there is this thing that one type of cell where it should not be present, it is present there. Then it causes the problem. So regarding pap smear can assess the presence of malignancy depending on the cells present in the specific region.
I think there are a couple more has come up. Would you like to answer it?
Okay, just go on.
This is one about hygiene. This is from Rituja Roy. We use many type of sanitary napkins. Is there any possibility of cervical cancer?
No, as long as you change your napkin in a regular interval, there is no such possibility. But sometimes females use the napkins like sometimes it in the last part of the period where there is not that much of bleeding. A female uses the one pad for the entire day. There is no such swelling, so she is using one pad for entire day. That's a not very good practice. It's the lack of hygiene actually. Otherwise, if someone changes the sanitary pads in a regular interval in maintaining the proper hygiene, it's not a risk factor actually.
Okay, I think there are a couple of questions from Debangana Mitru and Sritoma Sengupta. Same type of question. That is a sanitary napkin or menstrual cup or use of tampons has increased in recent times. Can this insertion increase chances of infection and cancer?
Again, the same thing. If someone is using in a proper hygienic way, it doesn't increase the chance. Be it tampon, be it sanitary napkin, be it menstrual cup. Sanitary napkin, it's a disposable thing. If it is changed in regular interval in maintaining proper hygiene, it's perfectly okay. Regarding tampons or menstrual cup that is being inserted inside the vagina, if it is inserted specifically menstrual cup, it is reusable thing. If you are using it maintaining proper instructions, it is okay, because these things are being used nowadays, but these are newer things. So till now there is no proven thing that there is more chance of developing cancer using this. But one thing is for sure, if you use all these things in a proper hygienic manner, as long as you use in a hygienic manner, they are perfectly okay till now.
Okay, there is another question from Shunubha Shaha. Do the hormonal pills like what is this Premount worsen the problem of irregular excessive menopausal bleeding? Is a woman exposed to greater risk who has taken this sort of pills quite often, even in the age span of 30 to 50?
No, the thing is that hormonal pills, there is no proven thing that hormonal pills causes excessive menstrual bleeding or postmenopausal bleeding. No, nothing like that. If generally the thing is that for hormonal therapy or hormonal pills, there must be a prescription of a specific physician. Without any medical supervision, generally this type of pills are not taken. If someone is taking or previously has taken this type of pills according to the prescription of the physician, then it should not cause any type of this thing like most menopausal excessive bleeding or excessive premenopausal bleeding, whatever.
Okay, so is there any other questions?
There is more question actually. After radiation therapy and chemotherapy, if one is having menstruation 2 times a month for a prolonged period, is it when it is a side effect of radiation? No, the thing is that for radiation therapy and chemotherapy, first we have to know where does this radiation therapy has been given. Like if the radiation therapy is given in the pelvic region for carcinoma cervix or carcinoma endometrium, it may cause damage to the ovary. For that, menstruation can be stopped. For regarding chemotherapy, some chemotherapy regimens specially used for the breast cancer or lymphoma, this type of specific chemotherapy drugs, they may stop menstruation earlier. Sometimes the younger patient may not get back the normal menstrual cycle. Sometimes after returning the menstruation, there may be irregular cycles 2 times a month like this. So if such things happen, then you have to consult a gynecologist. It may be a perfectly normal thing as the patient is addressed with chemotherapy or radiation therapy. It may be the changes that her body has accepted, and it's a perfectly normal thing. But you have to consult a gynecologist, that's for sure. And there is one more question: to do research work regarding cancer, what should be the primary or initial step? I don't understand actually. I couldn't understand.
Oh, this is
What does this
something.
mean?
I think she wants to know how to go about, that is advance, if she wants to do research work in cancer. I don't think that is the
Yeah, that's the
Yeah.
that's not
We'll
in
discuss
the
it. Debushmita is our student, so we'll discuss it with her.
Okay.
Now there
okay.
is one other question from Srijita Roy. We have college and tuition which extend for almost 10 hours each day, and during menstruation we aren't using the public toilet to avoid urine infection. So is
Yeah.
there any way in which we can maintain our personal hygiene?
Frankly speaking, there is no such way. In our society, for using public toilet for a female, it's a nightmare actually. And during menstruation, it's much more problematic. So just try to change your the sanitary napkins or whatever the thing. And if someone is using menstrual cup or tampons, I think that is it is my personal opinion thing, but I think that can be more unhygienic to use these things when you have to use a public toilet. Better when you have to use a public toilet, use disposable thing, that is disposable sanitary napkin. That is a bit better, but it is my personal opinion. If one can use other things in a proper hygienic manner, I am purely emphasizing on one thing, that is you have to maintain the hygienic manner. If you are maintaining that, it's okay, you can use anything. And yes, and no, there is no such thing that can be used or that can be maintained to avoid the infection in the during menstruation if one have to use public toilet actually.
Okay, is there any other question you want to put up, or you want to ask Dr. Day directly? Okay, I think we are done with the interactive session. And is Dr. Papia Ganguly there? Okay, so I think for today, I will conclude this session of awareness program by giving the vote of thanks also, because it has to be it was to be given by our other convener colleague Dr. Papia Ganguly, but she could not be here. I think she is in YouTube streaming, I think. So let me first thank our esteemed speaker, Dr. Arundhati De, and let me just introduce her properly, because she is an MBBS she has completed her MBBS in 2007 and completed her MD in radiation therapy in 2014, both from Arjikar Medical College, right, Arundhati?
Yeah.
Yeah. So and then she joined in 2015 at Apollo Gleneagles radiation oncology division. So we are so much indebted to you, Dr. De, for your
Thank you.
very enlightening and very enriching talk, and not only the lecture but also the interactive session. And you have seen that there in the chat box, so many thank yous are coming, and I thank I thank you from the bottom of my heart that you have come here today, and I hope and the other people, that is all the students, teachers and colleagues, they also hope that in future you will also come in this kind of webinar and give us this kind of enriching and enlightening talk on cancer, women, especially cancer of women, and I'm very much thankful to you. And next, I would like to thank all our participants and who have just borne with us the difficulties, some technical difficulties, and with us till the end. And they have interacted well with our speaker. And last but not the least, I would like to thank our beloved principal, Professor Shivli Sharkar, for her unstinted support in all these ventures of awareness programs in this college, which is usually organized by the Science Promotion Committee. And I also like to thank the members and other conveners of the Science Promotion Committee to organize such events. And I hope to organize this kind of events in future also. Thank you very much.
Thank you, all of
And-
you.
and-
And I have already given my number in the chat box. If anyone is having any query, any sort of query regarding disease process or anything regarding personal thing, they can call me without any hesitation. Okay. And it was a very good session from my side. I hope that it is beneficial for you people also. And thank you, ma'am. Thanks a lot.
Yeah. Okay. So I also want to thank Richa for taking care of the technical side of this webinar. And Richa, would you now give the link for the feedback in the chat box? Okay. So this session is concluded, right? Oh, thank you. Thank you very much.
Thank you. Thank you.
Yes, please fill up the feedback forms. The link has been given. And
Thank
also
you,
in and I also
you,
thank Mr. Shurojit Bhattacharya.
to allow us.
Okay, you want to say
Thank
something?
you very much, madam, to allow us to host the session. And we are looking forward to host more such sessions with you. We would like
Yes,
to have
sure.
some more interactive sessions.
Sure. We promise that we should organize this kind of event in future. Okay.
Absolutely.
Okay. So
Thank
very
you.
Thank you, madam.
Thank you.
Thank you very much, Dr. Arundhati.
Thank you.